Hi there, this is just an update really. I haven't been and done a blog for quite a long time now. It's August the 1st, 2013, and I started my treatment in September 2012, so near enough a year ago almost. Started off with having surgery and 4 nodes removed, and then from then on I went and had chemotherapy, FECT, which is fluorouracil, I can't even say it, but epirubicin, cyclophosphamide and docetaxel. I had 3 cycles of the 3 drugs together and then 3 cycles of docetaxel on its own. Following that, I was quite poorly and did a few blogs throughout saying about the different side effects, the tiredness, you know, becoming neutropenic, having infections, numbness and tinglings in my hands and my feet and my back and my face, and affecting my bowels. It irritates your bladder, back and joint ache, muscle pain, and it can also have changes in your heart and things like that. Also, along with all of that, of course, I had hair loss, complete hair loss all over my body, even up my flipping nose, and some of the drugs made my nose run, so that was dripping like a flaming tap a lot of the time. But that's all sort of becoming a little bit in the past now, and all those side effects are becoming an awful lot better and almost gone, to be quite honest with you. Finished my treatment with that going back 4 months ago now, so that's good. I've also had my radiotherapy. That was in the Lyndon Davis Centre in Shrewsbury, and they were all absolutely fantastic there. I went on to a trial called the Fast Forward, where I didn't have to have so many different episodes of radiotherapy. They reduced that quite a lot, and the overall amount of radiotherapy, I've got ants in my pants, excuse me, that I had overall was a lot less. They're hoping that in the future people will have sort of less doses of radiotherapy and just have bigger ones but less of them, so hence less side effects. I did have a few side effects, and but they were very limited really. It's mainly in the breast area, and that was extremely sore. In fact, it went very, very red and it did blister, and that's been a bit of a nuisance, especially trying to get to sleep and things like that. And when I've been going out for walks and things like that, when my boobs bounce up and down, so I've been a little bit sore, but that's all, you know, an awful lot better now. I mean, general side effects of radiotherapy, they do say are soreness and tiredness, and I probably have those too, but not to any great extent really, the tiredness. I've had to be careful as well going out in the sunlight, because obviously that can have an effect when you've had radiotherapy as well. You just don't want to risk sort of any sunburn or anything like that in the area. I've been putting cream on every day as well, and that's helped the skin because it's been a bit dry and sore, etc. I've had increased lymphedema as well in the left side, because I had initially nodes removed under my arm, and where those nodes have been removed and then having radiotherapy, that's been a further effect on the swelling in my arm and whatnot. And only yesterday I went to the lymphedema clinic where they measured my arm and had a good look at it and asked me about the different side effects and things. I'm going to get a sleeve fitted so that when I do exercise or I'm standing for long periods of time or gardening or anything like that to try and stop it swelling. And I've also been given by the really nice lady there some sort of massage techniques to try and help the lymph flow through, so it doesn't get stuck in my arm. So it's been caught early, so that's fantastic. So I'm really, really pleased about that. I've been having Herceptin treatment, that's been ongoing. That started during the chemotherapy and is now sort of continuing until December. That'll finish just before my 50th birthday, so 2 reasons to really celebrate in December. Fantastic. Herceptin itself doesn't, they say, give as many side effects as chemotherapy for a lot of people, but that obviously varies from person to person. The main side effects there are flu-like sort of symptoms, headache and nausea, and fatigue. Again, it's fatigue and it can affect the heart, so having regular heart scans to have a look at that, and so far, touch wood, everything's been absolutely fine. I'm having to pace myself. I'm still getting extremely tired at the drop of a hat. Mentally I feel back to normal, physically absolutely shattered. I'm on my 10th dose of Herceptin now, and I think it does have a sort of a cumulative effect. because I started to recover from the chemotherapy, and now I'm getting a little bit more tired again. But on the plus side, a lot of the stupid side effects from chemo are going. My nails are growing back at a rate of knots. My hair, as I say, is fantastic. It's smooth. It's a bit sort of fine and thin compared to what it was like, and my eyebrows are still sort of nearly non-existent, and my eyelashes are very, very sparse, and that unfortunately may never come back. If anybody out there has got any tips of how to grow eyelashes or eyebrows, please let me know, because if I can stand on my head for 3 hours a day or whatever, I'll do it. Looking forward now to sort of going back to work fairly soon, but as I say, I've just got to get myself a little bit fitter, I think. Best intentions in the world, my head's like, woo, you're there girl, you know, but I'll do something for 2 or 3 hours and then I'll come over with this, I just hit a brick wall and I've got to go to bed. I'm just so tired and I can't really do everything that I used to be able to do, but I think you've got to be patient when you've had cancer treatment. Your body's going to take a while to recover. It might take a year, 6 months to a year after all the treatment's finished, and as I say, mine's still ongoing at the moment. Got this port in my neck here, which has been absolutely fantastic. It means that I have the treatment in here every 3 weeks via the infusion, which means they can leave my arm well alone, which has thrombosed and is very, very sore still. But that's me really in a nutshell. I'll just give you a 12 because I want to show you how thick my hair is at the back. So well chuffed with that, as I say, and tomorrow I'm going to the hairdressers, going to get it dyed blonde, and I will come on here next time with makeup as well, because I've only done this for the purpose of the video, coming on here with a bare face, but I wouldn't go out of the house really without my eyebrows and things like that on. Overall treatment, I've met some amazing, inspiring people. When I had my radiotherapy, I met some people that made me very, very, very humble really. People that had got esophageal cancer, a lot of the guys with prostate cancer, and to be honest, when we were there, it was like party day every day really, and you just see what other people were going through and it just helps you along. I did meet a lady in America who said to me, why on earth put yourself through all of this, you know, why don't you just take B17, vitamin B17. She said she was having it injected every so often. She had inflammatory breast cancer, and she showed me her scars, and she showed me where the drain holes, where she had drains in her breast and everything, and she said that, you know, her chances of survival were very, very slim. But she said that with this wonder drug she got better and she didn't have to go through everything. And it is a flipping roller coaster going through all this damn treatment, but I just took it with a pinch of salt really. But these drugs, there's lots of different trials with them using this B17. It's basically cyanide, it's in apple pips, and it's in I think apricot kernels. Inside the actual apricot, they grind that up and they use that for treatment. Oh, hello! Ellie. So that's interesting, and there are foodstuffs that have got this B17 in, for example, loganberries, I did say apple pips, bosoberries, flax is another one that's got B17 in. But I think just eating healthy and, you know, doing a reasonable amount of exercise will help to keep you fit, and that's definitely research based. So that will help you along the way. I've just got a couple of more scans to have next month. I'm going for a check mammogram. I'm going to have another CT scan of my chest because they were worried that I might have cancer in my ribs, which when they looked at initially they thought was definitely areas of what they call metastases, but I don't think so. Anyway, I'm rambling on again, 10 to the flaming dozen. Just wanted to sort of say things are getting better, I'm getting better, and once this is all over, I'm sure I will, well, I know I will enjoy my life tenfold, because I know now what's really important to me, my family and my friends that have been absolutely fantastic. I must say thank you to everyone who supported me. You know, it really is amazing how people rally round and help you through it. one of my dear friends, or best friends in the whole wide world, Tracy, she's going through breast cancer at the moment, and another lady called Kath, or I've met quite a lot of people that have got cancer along the way, and I just want to say to them, you know, hope that their treatment's going really, really well, and get better soon. Lots of love.